Hi, my name's Carly, and today I'm going to be teaching you how to effectively put on and take off personal protective equipment, which can also be known as donning and doffing. Since the beginning of the COVID-19 pandemic, the importance of mitigating the spread of disease has been heavily emphasized. The appropriate use of personal protective equipment is one of the most effective strategies in preventing the spread of disease. Healthcare workers make up about 3% of the population in the large majority of countries and about 2% of the population in low and middle income countries. About 14% of the COVID-19 cases reported by the World Health Organization have been among healthcare workers. In some countries, that number can be as high as 35%. If personal protective equipment is not worn properly, there's a very high risk of contamination. It's really important to properly don and doff PPE. Cross-contamination is especially likely during doffing. So we've talked about some important facts regarding the effective use of personal protective equipment, and now I'm going to show you how to put on and take off PPE effectively. So to put on PPE, you're going to start with some hand hygiene. Rub for about 15 to 20 seconds until your hands are dry. Next, you're going to put on your gown. Fasten both of the ties. Next, you're going to take your mask. Make sure you put it on by the ear loops. And you want your mask to cover above your nose and below your chin. Make sure you fasten the nose band. Next, you'll put on your goggles. And lastly, you'll put on a pair of gloves. So you want to make sure that the gloves go over your gown. And that is how you put on PPE. Now to take PPE off, you're going to start by removing your gloves. So take the part of the gloves near the wrist and turn your glove inside out. And put that dirty glove in your gloved hand. Without touching the outside of the glove now, grab the inside of the glove with your thumb and turn the dirty glove inside out. Dispose of your gloves. Next, you'll perform hand hygiene. You'll now remove your gown. So unfasten the ties without touching the outside of the gown. Once again, do not touch the outside of the gown. You'll roll your gown inside out without shaking it too much. You don't want to spread some germs. You'll dispose of your gown in the linen basket. Perform your hand hygiene once again. Next, you're going to remove your eyewear. So you don't want to touch the front of the goggles. Just grab by the earpieces. Dispose of your goggles. Remove your mask, grabbing the ear loops. Lean forward slightly. Without touching the outside of the mask, remove and dispose of the mask. And lastly, perform your hand hygiene one more time. So I've given you a demonstration on how to properly put on and take off personal protective equipment. Now can you show me how to properly put it on, please?
Of course. You start with your hand hygiene. And then you take your gown. You put it on. And then take your mask, put it on by the ear loops. Make sure sure it's covering your nose to your chin. You fasten your nose piece. Then you take your goggles and you put those on. Then you grab your gloves. And you put your gloves on and you ensure that the gloves are covering the outside of the gown.
Great job. You've done a great job at showing me that you know the steps of donning and doffing PPE. You did a great demonstration. So now can you repeat to me in your own words what you've learned in today's learning session, just so I can make sure that I was clear?
Yes, I've learned today that healthcare workers make up a small percent of the population, yet a large percent of them are the ones who have been diagnosed with COVID-19. Donning and doffing properly is very important to reduce the spread of germs, especially doffing when cross-contamination is most likely to happen.
Perfect. Thank you. And now can you repeat the steps of putting on personal protective equipment for me, please?
Of course. So you start with your hand hygiene, and then you put on your gown, and then you put on your mask and your goggles, and then you make sure your mask is covering your nose to your chin, and then you put on your gloves and ensure that the gloves are covering the outside of the gown, and then you're ready to go.
Okay, great. Now what about taking off personal protective equipment?
So to take off your personal protective equipment, you start with your gloves and you take them off without touching the outside. So you take one off and you put it in your gloved hand, and then without touching the outside, you peel off the other and you dispose of the gloves. You do hand hygiene, and then without touching the outside of the gown, you take off your gown and you roll it up so that the inside is out, and you dispose of that. And then you hand hygiene one more time, and then you take off your goggles without touching the front, and then you take off your mask, and then you hand hygiene one more time.
Perfect. Thank you so much. You did a great job today.
Thank you.